Hey everyone, and welcome to the Balanced Bodies Blueprint. I am your host, Vinny Russo.
And I'm your co-host, Dr. Erin Stansfield.
And we're shifting gears from all the conventional fitness narrative you hear on most fitness podcasts, as our main emphasis lies in preventative healthcare, adopting a holistic approach to nutrition, and challenging the traditional views on various fitness topics.
Our mission with this podcast is to provide you with the information you need to achieve optimal health.
And on today's podcast, we have a very special guest with us. Her name is Victoria Felkar. Victoria is a renowned researcher, educator, and consultant specializing in the intersections of physiology, endocrinology, and human performance. Her groundbreaking work has shed light on the complex roles of hormones and how they play in athletic performance, particularly in female athletes. Her research focuses on the understanding the nuances of hormone health, the impact of performance-enhancing drugs, and the historical and cultural context of these topics. She's a leading voice in debunking myths and bringing evidence-based insights to the forefront of sports science. And we are very thrilled to have her on our show today to discuss mainly hormone changes in athletes, the menstrual cycle, pharmaceutical interventions, and her current cutting-edge research. So, Victoria, did I leave anything out?
I don't think so. I think I have even more than more so. So it's great. Thank you guys so much.
Of course, and thank you again for taking some time and doing this podcast with us.
Yeah, we are very excited to have you on. Thank you again. I am just curious how you even started out in this field. How did you become interested in this very specific field?
Yeah, I'll give you the Cliff Notes version. So I was a female athlete myself growing up. I was a classical ballet dancer. So I went through the ringer of an eating disorder and overtraining while going through puberty. And at the time, I was about 13 years old. I had just gone through menarche, which is the first menstrual bleed. So I had one. I had a second one. They were terribly long. They were about 2 weeks long each. My mom was a nurse practitioner, and she was like, "You're going to be anemic if we don't get on top of this soon." So I went to a doctor and was put on the pill at a very, very early age.
Mm.
And so I had this lived experience of being a young individual that was an athlete going through this world that there really wasn't a lot of discourse or conversation. It was kind of like, here is your solution in terms of being on the pill. And at about 16, almost 17 years old, I decided to come off. And at that point, I had gone through eating disorder recovery, had found the gym, loved squatting more than I ever thought imaginable, and was way better at it than I was ever at dance. So kind of shifted my focus into strength training. And again, back then, this is the early 2000s. There wasn't a lot of information about women and strength training. I was one of one really in the gym that I trained at. And so, going through that world as this very curious young individual wanting to learn more, got me into sport science for my undergraduate degree. Meanwhile, my health erupted in first year university when my body tried to ovulate for what would have been its first time. And going through the medical system, nobody knew what to do with me because I wasn't your typical patient in terms of my age. I was under 20, my athletic ability, my muscle mass, my just overall kind of endocrine makeup didn't reflect what they were typically used to seeing. And so it was this really alienating experience for me. And then going through the research in school, being like, I'm not alone. Like, I can't be alone. I'm looking at all these and learning about all these statistics about the numbers of female athletes that have amenorrhea or that have menstrual dysfunction. So I can't be alone in this. And yet I feel absolutely like an alien in all of these different specialties, doctors' offices. So that really was my gateway into it, was how can I better understand this, not only for me and my own journey, but for other women? And then how do I actually create some type of change in how we look at these topics so that hopefully, and now I get to do this, so I love it, but it was hopefully so I can talk to the practitioners and the people that are at the kind of the top down to help create and support change in how they actually do medical practice and create information, but then also the bottom up, working with athletes and educators on how can we give them the better understanding about what's going on in their bodies too. So it's kind of that top down, bottom up, and this is where I am today. And I absolutely love that I'm fulfilling my purpose. So
I love that you start with looking at the data though. Actually, like looking at this needs to be studied more, and
yeah,
because that's speaking to the language of the people that are at the top, right? The medical doctors, and I can really appreciate that. That's quite a purpose.
Yeah, and having something like you're paying it forward. You had a situation that happened when that affected you at a young age, and now you're paying it forward by trying to figure out, well, what's going on? How can we avoid those like what I went through? So
yeah.
yeah, that speaks to your purpose. It really does. Let's touch a little bit more on the menstrual cycle and athletic performance. So for those who may not be familiar, so we do have male and female audience. Could you just explain what the menstrual cycle is and what it is not?
Yeah, I mean, it's the best place to start, in my opinion, because there are so many myths and misperceptions, misunderstanding, antiquated ideas that somehow we're still dealing with in 2024. So I do love starting there. So I think overall, and bless my husband because I actually made him define this a couple of years for me. I was like, "What is the menstrual cycle?" Because I was curious. You get in it so much every day that you forget what other people
Right.
think of a certain topic. And the way that he said it to me, and I love this definition, was it was like, well, it's a cycle of an of hormones that somehow ends in a bleed. And I'm like, that's great, because I feel like that is what a lot of people's interpretation of it is. And that when we kind of begin to break that down and try to understand it better, it is a very complex, dynamic physiological process that occurs within biological women. And it is how we create a big proportion of our reproductive steroid hormones, androgens, estrogens, and progesterone. And that it involves an incredibly complex communication between our brain and our ovaries, as well as the rest of our bodies. And so when we talk about it from more of a physiological perspective, is it's this communication that takes place between the hypothalamus in the brain, the pituitary in the brain, and within the ovaries. And these create a very dynamic, kind of beautiful, almost like a orchestra of different signals that get sent back and forth, and that the end result is the production of adequate amounts of androgens, estrogens, and progesterone from the ovaries, albeit most people perceive it to be the bleed, and that the bleed is what we should be talking about. The bleed is the big finale of this kind of monthly process that occurs, when actuality, it is actually the creation of adequate levels of hormones. Over time, though, and the way that I learned this, and I think I've educated it. If you guys have heard me on podcasts before, I have said this a lot, but because the bleed is a very visceral thing that we can see tangibly, it became the sign of what we associate with the menstrual cycle. The very real thing that you can't refute, that I am having a bleed, every 26 days or every 30 days. And therefore, this is the menstrual cycle. When it's a lot more complicated than that, because women can bleed for many, many different reasons. There can be many different underlying hormonal milieus or environments that can cause just different durations, different frequencies of uterine bleeding. So the way that I like to think of it, I guess the most simplistic definition, kind of bringing it full circle, is that the menstrual cycle is a complicated communication feedback loop that happens between the brain and the ovaries that creates and supports the production of ovarian steroid hormones, of androgens, estrogens, and progesterone in what should be a around monthly process. So around, because there is variation in the duration of time between these cyclical productions of hormones. When we look at what is actually encompassed within this, there are, again, it varies depending on what you're looking at, what research, who's talking about it. but we can look at it as two main phases that occur. So in that 30-day or 28-day span of these changes of hormones, we have the follicular phase, which is the first half of the menstrual cycle, and this includes the bleed. And then we have the second phase, which is the luteal phase. And that these two phases, we can further sub break them down into like early follicular phase, late follicular phase, and then between the two phases, we should have ovulation or mid-cycle, and then we have early luteal, late luteal, and then we have the bleed. And that whole series of events is, I mean, it's when we should, as I said, be making our reproductive hormones, but there are so many different versions of what this looks like and what events happen within these different phases, and then how long they are. I know that's a bit of a big answer, but it's because it is a big thing.
Yeah,
And
no,
part of the
of
beast
course.
that I tackle is trying to redefine what that means.
Yeah, and it's funny that like the two phases, the only way I
Yeah.
was able to remember it was follicular starts with an F, so that means first, because first starts with an F,
Yeah.
and luteal starts with an L, and that means last. So the
Yeah.
last phase, yeah, that's the only way I was able to remember that. But there are some very, very different dynamics that go on within those two different phases. Um, from my understanding, and please correct me
Mhm.
if I'm wrong. But in the follicular phase, the estrogen hormone, that's going to be the dominant, right? Compared to the luteal phase where progesterone is going to be the dominant hormone, correct? Or
Yes
not?
and no. So,
Okay.
and I'll explain why. So, the thing that I don't love about that definition is that it
Too
makes it
simple.
sound like, no, no, not at all. It makes it sound like in the luteal phase, we're not making estrogens. And that's not the case at all. So, when we say there's a dominance in one part, it also then makes it sound like we should be making progesterone in the first half. And that's not the case at all. And
Mhm.
so when we think about what's the hormonal, and this is of what we would call an ovulatory menstrual cycle, which by nature of what it is, the menstrual cycle should be ovulatory because that means that all of these specific checkpoints have occurred. So when we think of just like what is happening at the what we call the ovarian cycle, because we have an ovarian cycle and then we have a uterine cycle, they come together. But so
Mhm.
when we think about what's happening at the site of the ovaries, in the follicular phase, we are making a significant amount of estradiol in what you can kind of think of as a reverse bell curve or a U shape. So we're coming up, we're looping to the top, and then we're coming down. But we are still making it in the second half of our cycle as well. It's not like we should be flatlining. We actually have to create adequate amounts of estrogen in the second half of the cycle to be able to have a healthy next menstrual cycle, because all these things are intrinsically connected. Um, Progesterone is created in the second half of the cycle. So our levels of progesterone raise a ton from baseline. And so in the second half of the cycle, we are producing anywhere between, I mean, research varies on this, but like 1,000 to 1,200 times the amount of progesterone we would have at baseline, which would be in that first half of the cycle. Estradiol, which is the main form of estrogen, its rise from baseline is relatively lower. It's anywhere between about 300 times from baseline. So we're not getting that same kind of magnified hormonal production as we do from progesterone. So, from a hormonal basis, yes, we're producing estrogens predominantly in the first half, but we're also still producing them in the second half.
Mhm.
We should not be producing progesterone in the first half. Physically, that would be completely counter what should be happening at the site of the ovaries and what we know can actually happen. We are producing progesterone only in that second half or the luteal phase. And it's as a result of having adequate levels of androgens, adequate levels of estrogens, and particularly estradiol, which is then creating a sharp rise in luteinizing hormone from the pituitary gland, which then allows, if all the stars align, allows us to do a physiological process called ovulation. And it is because of ovulation that we then produce progesterone.
And speaking of ovulation, by the way,
Yeah.
thank you for the very detailed
Yeah.
view of the hormones. And I can appreciate that. Nothing is really black or white in physiology, even though sometimes when we read in like textbooks or even basic physiology books, I think it's almost to convey the point, right? Like you have to think you're teaching students, and so you think, well, this is estrogen dominant, this is progesterone dominant. So
Yeah.
I can really appreciate the details that you just explained there. But speaking of ovulation, can you kind of touch on the importance of ovulation just for normal reproductive health, and then maybe speak to um, the athletic performance and maybe how that's affected with if you do have an ovulatory cycle, what that
Mhm.
means.
Yeah. So ovulation, so as I mentioned, like by definition, the menstrual cycle should be an ovulatory menstrual cycle. However, that's not what we see in, I mean, anywhere from 1/3 of just regular women's cycles. And we see it even more in the athletic population. Some predictions have been like 2/3 of the athletic population do not either create enough progesterone, which the term for that would be luteal phase deficiency, which means that the amount of time from when they ovulated to when they start bleeding is not long enough for adequate levels of progesterone to be produced. And therefore, it causes over time, particularly kind of this like systematic breakdown of the communication between our brain and our ovaries. Or they don't ovulate at all. So that's called an anovulatory menstrual cycle. Now, in both those situations, you can still get a menstrual bleed, but we would just call it menses, or an abnormal uterine bleed would be the actual technical term, because if you didn't have a proper menstrual cycle, you can't have a proper bleed. Therefore, we can't even call it that. But that's getting super, super technical and nuanced. So when we think about ovulation, like what is it? And it's such a great question. And it's one that I love when, especially when I'm educating with people in the research field, is because it's something that we've associated almost solely with fertility. And so even when you look at just like a textbook answer, it says ovulation is the physiological process that permits fertility and therefore conception to occur when the sperm and the ovum or the egg meet. But so much more than that, because it is through ovulation in which the egg, which is producing the amount of hormones or a set amount of hormones in our ovaries, is then able to get into the right place for us to be able to produce progesterone. So we can't produce progesterone if we don't ovulate. And if we don't produce progesterone, we not only have this kind of like breakdown that occurs over time, if we have repeated absence of ovulation in our hypothalamic pituitary ovarian axes, but then also systemically. So progesterone is extremely important for bone health. We have to have it to help actually support creating and maintaining adequate bone health. We have to have it to be able to help support our uh, pituitary and hypothalamic just overall health, our neurological health. We have to have it to be able to support our thyroid. And so over time, when we don't ovulate, there are both like hypothalamic pituitary ovarian issues that can occur, and then also systemic issues that can occur. And this is something that I feel like hasn't necessarily been talked about a lot. I know even within my own like undergraduate degree where I was doing like biomedical science classes and like advanced physiology classes specifically in women's health, we didn't talk about the importance of ovulation like this. We talked about it only as it related to conception. It wasn't until I got into my master's that I really began to dive into it. And so that for me, like again, kind of looking back in retrospect, it's going, okay, well, even within this kind of like academic setting, we weren't learning about the importance of ovulation in post-secondary. Therefore, how should I expect the everyday individual to know about it? And I think that right now we are seeing a movement. Menstrual cycle tracking apps, for example, are doing a great job at kind of promoting this physiological process and putting it at the main stage, taking that kind of emphasis off the bleed as being this marker of female health and fertility and hormonal balance, even though I hate that word, and changing it out for the importance of ovulation. I still, though, see a huge lag in understanding, particularly within the athletic world.
Well,
And
I
I think a
think
lot of that,
it's sorry
yeah,
to interrupt, but I think
no, no,
it's so important because they, especially athletes think, well, if I'm menstruating, then I must be ovulating. And
yeah.
that is a misnomer. Like, that's not always true. So sorry,
Absolutely.
continue.
No, you're completely right. And that's what I see a lot of. And I see that also within the research too. And we'll probably get into that a little bit more about some of the problems with the research that's been conducted by exercise science and exercise physiology and sport medicine is that they haven't actually controlled for ovulatory menstrual cycles. And they've used the bleed as the signifier to conduct research about how the menstrual cycle impacts athletic performance or a specific marker of athletic performance. And that's so bad. Like that's just bad methodology.
Bad data
Um,
then.
oh, it's terrible data. So going back though, like how does ovulation impact athletic performance? Reality is we don't know yet. And it's because we don't have great data that exists. There's
Right.
been hypothetical kind of models that have been created, but even within those models, if you actually look at how they're discussing progesterone, is it's this very myopic way that's not actually looking at what does this hormone do for female physiology beyond reproductive function. What does this hormone do for other systems of the body? And how does this hormone therefore impact an individual? But not only that, we can't look at hormones in isolation. So when we think about something like progesterone, we know that progesterone has an incredibly important kind of like balancing equilibrium status with estradiol, and that there's ratios that need to exist in order for us to have an absence of certain symptoms or characteristics. So a lot of the kind of I guess symptoms associated with like premenstrual syndrome. We now can look back retrospectively at that early data and go, well, it was because a lot of women weren't ovulating, and that's why they were experiencing really heavy menstrual bleeds, for example. In the
Right.
uterus, progesterone acts um, as a what's the right word I can use for this? It balances the impact of estradiol. So estradiol in the endometrium, which is the lining of the uterus, it causes the lining to grow. That growing is what we associate with like after it sloughs, that's the bleed. So in the first half of the cycle, our endometrium is growing, and then in the second half of the cycle, we need to have enough progesterone to stabilize that endometrium. When both get taken away, we get a bleed. So women who have really heavy cycles or mid-cycle spotting, for example, typically aren't producing enough progesterone. And we now know that. But back in like the 50s and 60s, when they were creating all the studies around premenstrual syndrome, they didn't know that. So they just said that, like, here's this diagnosis, but not actually looking at like the hormonal milieu that reflected in it. And why this is important, again, try to come back full circle, is that a lot of ideas were built around decrease in athletic performance during the premenstrual phase, and these still exist today. I mean, I shudder to go on social media and I see people talking about like syncing your cycle with your training and all of these other kind of like antidotes that really aren't reflected in proper research. Number one, there's no data to support it. Number two, the justification that's used isn't taking into consideration what the actual hormonal milieus are. So, for example, when women have this huge influx of symptoms that occur premenstrually, we have to ask, why is that occurring? And when we begin to look at some of the research that's been done on athletic populations, and even general populations that have these symptoms, we see that usually it's a luteal phase deficiency or an anovulatory cycle. And that so then it goes, okay, this is now occurring because we're seeing let me say an skewed ratio of estradiol to progesterone,
I like how you didn't use
among other things.
unbalanced.
Yeah, I had to catch myself
Skewed.
because it's one of those words that's like so overused and
Yes.
incorrectly, because hormones aren't supposed to be balanced.
Right.
I mean, even something like cortisol is not supposed to be balanced. You're supposed to have a rise and a fall
Right.
and an alarm phase. And like it makes me laugh because I go like, well, it's me. And again, maybe we'll get into this, but I see this a lot with performance athletes that I work with and physique athletes that I work with.
Mhm.
There's this expectation that performance should be stable and increases, whether it's like increasing in the ability to lift a certain pound or let's say fat loss, should be very linear.
but it's
And
not.
that it's exactly. And there's this perception. It's like, this should happen. But I go like, what in the human body is like that?
It's a
Like,
non-linear process. All of those
exactly.
things. Yeah. It's
Yeah. And that
about
the
the ratios, about, when you speak of hormones, a lot of it is ratios. And there's a range of ratios, and I think that's so it's even genetically influenced. And maybe you can speak a little bit more to that, because I don't even know the research on that. But it's so detailed. Um, and I think that anybody who speaks to it as it's a balance or it's a certain number is misinformed.
absolutely. Because it's complicated at the end of the day. And I think that's where when I just reviewed a paper last week for somebody, and I had to remind myself as I'm reviewing this paper for publication, it's like it's still important to get research out, even when research is not covering every single nuance. There's a way that we can write an introduction. There's a way that we can write kind of methodologies that allow us to speak to these nuances without going like head first, which for a lot of times you can talk yourself out of the study if you look at all the nuances.
Of
So
course,
it's
yeah.
still important. We have to put research out, especially on women athletes. It's so important. But we have to do our due diligence to then say, like, okay, how can I do this better? How can I look at this with methodological rigor? And how can I make sure that my participants are not this is something we see a lot in the female menstrual cycle performance research is that having self-fulfilling prophecies that their menstrual cycle should be causing a decrease in performance. And then that research has been done, and it's showing that like when people have a negative perception of their menstrual cycle, that it will cause negative symptoms and effects.
Right.
And so it becomes this whole world of like, how do we study the menstrual cycle? It's so freaking complicated. It's got so many nuances involved. We have to be able to do our best we can with our populations and our methods and our selection. And then we have to put this work out so we can continue to build on it over time. It's never
Yeah.
going to be perfect.
Well, and just one more thing, I know Ben wants to talk, but I clinically speaking, I'm seeing the patients and seeing some of the, complaints of the patients. So I'm kind of far removed from that research aspect. But even in myself, like, doing bodybuilding competitions, I think that's when I first had an appreciation for an ovulatory cycle, right? Because I lost my cycle for couple of years and nobody knew how to deal with that, like an OBGYN, for example. And so really that research becomes very critical, clinically speaking, to treat these kinds of patients and to kind of understand where they're coming from. And I think, understanding that bleeding is more complicated and all the hormones at play, it's not just about the bleed. That doesn't mean you're normal. Or losing your period isn't necessarily a bad thing depending on what your goal is. But also recovering that is very important
Mm-hmm.
physiologically.
Yeah, and there's a whole spectrum of different menstrual cycle dysfunctions. And so if we think about on one end of the spectrum, there's a regular ovulatory menstrual cycle with the absence of symptoms. Like that's on one end of the spectrum. On the other end of the spectrum, it's insufficient hypothalamic and pituitary, so our like more of our neuroendocrine signaling and also our ovarian signaling or hormone production. So amenorrhea, that's on the other end of the spectrum. So there's a whole bunch of different both neuroendocrine, um, let's say deficits or different types of kind of clinical pictures that exist, as well as ovarian pictures that exist, as well as just general systemic health issues as well that can exist within this continuum and influence how somebody experiences or doesn't experience a regular ovulatory menstrual cycle. It's not just one thing. And I know when I was going through school, and especially this was like one of the things I struggled with myself with my own story, was that it was either you had a menstrual cycle, which was assumed to be ovulatory, or you didn't. There was no discussion about all of these different clinical pictures that we have in the middle,
Right.
as well as considerations about context. So, for example, how long have you been experiencing these challenges
Correct.
for?
Yeah.
How long have you been amenorrheic for? At what age? We know that that first 7 to 10 years after menarche or the first menstrual bleed is an incredibly important time for the reproductive system to literally begin to learn how to work. And that
Right.
some authors have even extended it into the first 15 years, saying that in that first 15 years, the communication kind of highway between our hypothalamus, our pituitary, and our ovaries is still figuring out what to do. It's still very vulnerable to different types of stressors, whether we're talking about internal to the body or external to the body. And so during that time, if we lose certain ovarian function or if we have altered pituitary signaling, that can be incredibly challenging then to regain function later in life. And so these are the conversations that within sport, they just weren't being had. And I would argue they still aren't. I think we're
Yeah.
starting to get more
Right.
consciousness around it. There are things that like I saw more, again, this I guess comes back to my background that's more like interdisciplinary, is that more nuanced conversations were happening in like neuropsych. More nuanced conversations were happening in like advanced, like metabolic and endocrine research, but they weren't being translated into the applied sciences like
Right.
sport science and sport medicine. And so there was this very basic model that's been used that hasn't been added onto until probably like the last 4 or 5 years. And now we're slowly starting to see that change. And one of the best examples would be with athlete amenorrhea. And that, so when I was young, it was the female athlete triad. That was the only
Right.
conversation that was having. And it was that combination of if you're an athlete and you have low body comp or low body fat or low weight, they didn't even look at body fat, it was low weight, with your also absence of a bleed, you're at high risk of osteoporosis and low bone density. And it was that trifecta, and that came out of the 90s. And that model, I mean, at 13 years old, being told, "Oh, you've got to get a bone scan," and I'm being like, my mom was like, "Wait, her bones are still developing. Like, she just got hormones for the first time. Like, no, no, no." But that was the model. We now have this
Right.
beautiful shift that's happening where it's going, okay, sport is not just going to cause amenorrhea to occur. And having low body comp is not it's not the only thing that's happening and going to
Right.
cause amenorrhea to occur. And sometimes there are no changes to bone density if these issues are happening for a short period of time. But if they're happening for a long period of time, of course we're going to have bone density issues because we're not making androgens, estrogens, and progesterone required to build and maintain bones. And so we have to look at that kind of total duration of time. Today, there's like the idea of low energy availability in athlete populations, which looks at kind of our more input versus output. So, how much nutritional intake are we taking in versus what's our output? But even that,
is that like Reds?
that's REDS, exactly,
Okay.
relative energy deficiency. But there's even more newer models coming out, and these are the models that I think I've kind of more fell in line with and really appreciated because they're the ones that look at and say, wait a second, it's any stress. It's we have to look at stress from nutrition. We have to look at stress from training. We also have to though, look at psychosocial stresses. We have to look at stresses relative to other health issues. We have to look at the bigger picture of what's happening. And those models, believe it or not, they came out in the 50s. They're nothing new. They just got forgotten, completely forgotten. And then, the only focus was on body fat, which
Yeah.
drives me nuts because, of course, we now know that it's not just about body fat. It's not just about how much you weigh or you don't weigh, right? Low weight. It's not just about how much you eat or how little you eat or how much you train. It's got to be relative to that individual. We see research that's been done. It's been a fascinating newer kind of area of work that's looking at how if an individual suddenly increases volume of output and decreases food, they will have a shift in their LH signaling. And that will happen and occur almost, I mean, some research has said like within 5 days, depending on their age.
Wow.
And that then you start to see almost like a graded staircase down if that continues, where we go from, okay, now we have this altered signaling. Now this is affecting how our communication is occurring with our ovaries. Now our ovary communication is having that feedback loop, and we're reinforcing this kind of negative cycle to occur. And that, depending on how old somebody is, so if they're kind of that first 7 to 10 years after menarche, that those changes can be much greater in that LH signaling. But if you make minor changes over time, you don't see that same effect. So if you slowly increase volume of training and you slowly decrease caloric intake, then we don't see those same modifications happening to LH signaling. And this whole kind of like cascade effect occur is not as great,
Dramatic.
or for some individuals, it doesn't happen at all.
Yeah.
And in our world, this is an important thing, because this is that idea of why do some individuals not have pronounced menstrual cycle dysfunction even at the highest level of sport, and others do. It's because it's way more complicated.
Yeah, that's fascinating.
Yeah.
Very fascinating.
And I love how you said before how like you're doing we have to do the best we can with what we have available. And this is getting to be so new now. And you're actually bridging that gap to bring it into these interdisciplinary fields. I think Maya Angelou said it the best. She said, like, you do the best of what you can. And then when you know better, you could do better. And it's like, as you keep learning more and more about this, more and more comes out, we can actually help the female athlete in particular with some of the things that we see going on here. But I want to kind of just navigate this discussion a little bit more towards the myths and versus the research, because you touched on that, and she gave me a little kick under the table. But there are many myths surrounding this menstrual cycle and athletic performance, and I just want to know, what are some of the most common misconceptions you've actually encountered or hear about?
Yeah, I mean, every week at this point, where I get questions on like my social media in particular about cycle syncing. So I would say right now that's probably the most dominant myth that I'm seeing. And that's that idea that you should tailor your workouts to the phase of the menstrual cycle you're in. Not even workouts, and nutrition now.
I was going to say nutrition too, right?
Yeah, both of them. And
Does that include like seed cycling? Right, because I heard
yeah,
that seed cycling. I never really got into that. I'll get into the whole nutrition stuff because I actually believed in some of it. So I can't wait to learn about this. But the seed cycling I knew was nonsense when I first heard it. So yeah, keep going. I'm excited for this. I'm getting excited.
So and this, I mean, if you guys could see my desk, like, it is disgusting because there's about, I've looked at personally over 2,000 pieces of data on this. So that's not looking at everything. There's more. But, you know, the idea, the most simplistic form of the idea would be that there are certain dietary and training, let's just say, programs that you should be doing that align with specific hormonal milieus or hormonal environments associated with the menstrual cycle. So the idea that, like, if we think about that follicular phase as being estrogen, and this is literally the words that they use, like rich in estrogen, then we should be training a certain way to facilitate the most amount of growth and recovery and health. And that in the luteal phase, when our progesterone is higher, we should be doing certain things. And then when our bleed occurs, we should be doing certain things. So first and foremost, there is no empirical support for this. So, like, none at all. That's good quality research. So people will say to me, and this has happened at a conference where somebody said, no, I've got the study here. And I said, okay, let's look at the methods. Let's look at the claims that were made. Let's look at the background information that we were used to support even this happening in the first place. So it's the good quality research does not exist. And I don't think we're ever going to get it because of the complexity involved. You know, that we're not thinking about, for example, hey, somebody's training age. How does that impact how they respond to different, you know, physiological changes in their body, or their sleep, or their actual activity that they're doing? There are so many kind of different facets here that will impact our performance at any hormonal milieu. And the great kind of thing that I point to in people are in the research on this is that, like, when we look at the research that's being done on like menopausal, postmenopausal women, that have this absence of ovarian hormone production. And we look at the fact that they are still able to make gains in the gym with having like very ultra low estrogens, no progesterone, like the research that's been done without HRT involved.
Right.
They can still make fat loss gains. They can still make oh my God, muscular skeletal, there we go, gains, just through having good weight training program. That's it. And
Yeah.
so if we can see that happening within the female population in the absence of hormones, why are we fixated on the idea that we have to be doing certain things when our hormones are at certain levels? The research underscoring this comes from the idea that, about less than 100 years ago, even up until like about 50 years ago, women were not allowed to participate in sport during the menstrual cycle or physical activity because of social taboos around it. That there wasn't the proper sanitary products for women to go swimming, that there were ideas that the broad ligaments of the pelvis couldn't support a menstruating uterus while they jumped. Like just absolute pseudoscience, but that got indoctrined into sports science and exercise physiology. And so we see then people trying to prove that claim.
Mm-hmm.
And it just has been passed down over time. So when we actually look at the science though that's being done, and there's some great meta-analyses and systematic reviews that have gone through all of the data, they've scored it, they've weighted it, and they've said, hey, we don't have sufficient evidence on this. When particular claims are made about a specific hormone and how that particular hormone impacts, let's say, hypertrophy. Usually those studies are done either on rat and mice models or animal models, and they're not being done to look at all of the different factors involved. So a great example of this is something like progesterone. So there's a claim going around right now, and it drives me crazy, that progesterone is a catabolic hormone. And I'm like, huh. So of course, me being my inquisitive mind goes like, where did this come from? Where do people think that luteal phase, you're suddenly this catabolic like machine and you're going to burn through all of your muscle? And it's because progesterone, if you actually scrap and kind of look at what's happening underneath, is progesterone increases your basal metabolic rate.
Yeah. Mm-hmm.
And that your basal metabolic rate increases. It varies 300 to 500 calories per day, which is why you're hungrier. And sometimes if you ovulate the second half of your cycle, but it is not as much for increase as that you think it would be. That's going to massively like impact your skeletal muscle, because we also have intracrine or internal muscle hormone dynamics that differ than our systemic or external to the muscle hormonal dynamics. Those two things are different. And so that's just one of the different complexities involved. There's also how progesterone actually promotes skeletal muscle development. So when you start looking at the models under a different light, you can find data that actually refutes the idea that it's catabolic. And so when, for somebody like myself in this kind of this world, it's like for every claim, I can find an opposite claim or an opposite finding,
Right.
which that means, like, again, simplistic, they cancel each other out. And what are we left with? No findings, no
Correct.
answers, more questions.
Yeah.
And so
Yeah.
that's what I see is like the number one thing right now is this idea of cycle syncing. And if I look at like what are we looking at with the research? So when we think about like athletic performance in that world of like how the menstrual cycle impacts athletic performance, the research itself is absolutely, they tried. They did the best they could with the knowledge they had, but it is terrible. So, for example, they did not actually survey women to find out if they were having ovulatory menstrual cycles or not. They were just using that bleed as that benchmark of whether or not they had a menstrual cycle. They compared populations together that shouldn't have been compared. So, for example, they compared sedentary people who'd never participated in sport before and how they experienced the menstrual cycle during a physical activity program with elite athletes.
Yeah.
And it's
Right.
like those individuals are going to have very different experiences. They looked at, they compared menstrual cycle with oral contraceptive users. And they said that the oral contraceptive was a good kind of fill in for a hormonal milieu of what should be happening. We know that that's not the case at all. And so and I mean, those are just two. They didn't account for silent ovulatory disturbances. They didn't look at erroneous factors or external kind of variables going on, like training status or environmental issues, or even sample size. The performance environment itself wasn't replicated. And so they were taking, let's say, like elite female college soccer players and sticking them in a lab on a treadmill and measuring their max VO2 and saying that that was their marker of performance for how it would impact soccer. Well, we know those things don't reflect.
Translated. Well, there's so
Exactly.
many confounding variables, right? And I think that's what, you know, anyone can jump on PubMed and you can find evidence to support whatever point you find on social media, right? You'll find one study, but the study design is terrible. Or if
Mhm.
you dig into the study and look at the study population, they didn't control for any confounders, especially in this population, right?
Yeah.
Especially in athletes. And unfortunately, the numbers, like the N, is so small. They haven't been studied adequately to actually make any valid conclusions that we can generalize then to this population.
Yeah. I mean, right now I'm working on a project on like the impact of reproductive aging for skeletal muscle health. Essentially, is like the short form of it. But it's interesting because you do see different claims being made, even in the research, where it's let's say the impact of estradiol on satellite cells in skeletal muscle. But then you actually look at the study itself and you go, okay, there were two papers that you used to make this claim
Mhm.
that then your study didn't actually contribute to. It was neutral. You didn't find anything supporting it and you didn't
Right.
find anything against it. But then I see that study on somebody's social media page
Perpetuated.
who is
Right.
seen to be this like expert in the field with their little like, DOI next to it. Like that is a signifier that this is
Hmm.
legit. And it's like they just looked at the study title and they've
Right.
said
Right.
estradiol impacts satellite cells and skeletal muscle. And I'm like, wait a second, no, it doesn't.
Mhm.
That
Yeah.
study you cited doesn't actually show me that at all. And the
Right.
research that they cited as their rationale for the study, it was two. Well, we know
Mhm.
that two animal studies are not, adequate for
Yes.
a research to be done, even in a randomized control trial.
Yeah.
So it blows my mind right now with all of these claims that are being made around the menstrual cycle. Another big one is just that idea that all menstrual cycles are the same, which is really what the premise of like eating for your cycle or um, training for your cycle is based on. It's this notion that every cycle women have and every cycle a single woman has is going to be the same. And
Mhm.
all of these cycles reflect this set level of estradiol that's going to be achieved in the follicular phase, the set level of progesterone that's going to be achieved in the luteal phase, and as well as also this level of estradiol in the luteal phase, and that this same experience of the uterine bleed is going to happen.
Right.
That's not the case at all. No two cycles are the same, and that there are so many different variables that impact it. And then, going a little bit deeper, what we see in other fields outside of sport is the idea that, and it's not just an idea, it's been shown in research that there are amplifications that can occur from cyclical changes in hormones. So, what I mean by that is anxiety, for example, that typically speaking, if somebody experiences premenstrual anxiety, that is an amplification of anxiety that already exists. It's just overt, it's more exasperated in the premenstrual phase as a
Different
result of
phases.
the
Yeah.
change in hormones. Exactly.
Yeah.
Or chronic pain, that certain individuals will experience higher levels of kind of their chronic pain scores premenstrually. But that doesn't mean that they didn't experience any chronic pain in the other parts of the
Mhm.
cycle, because they did if
Mhm.
you actually look at their scoring. And so a lot of times things get almost like perpetuatable. We have these symptoms and that's why it's happening. That's why you need to do Pilates in your luteal phase. And it's like, well, no, actually, like, let's look at this research. Let's
Yeah.
actually see and let's look at what the claims are. If you're saying you're physically weaker, well, let's ask why. Where
Right.
did those findings come from? Because
Mhm.
they sure ain't coming from sports science, at least not good sports science.
Yeah.
Right.
Well, let me ask you a question. So A lot of my readings done in the past was mainly from Lyle McDonald, and I feel like he was someone who brought a lot of attention to the female, especially the female
Mhm.
athlete. And one of the things I remember, because my whole thing is nutrition, so I really got into depth of like what he was talking about with nutrition and females. And I remember him saying, and I would love to hear you correct him and me. Um, but basically is that like during that follicular phase, um, the the assimilation and the usage of carbohydrates is more pronounced compared to the luteal phase. So the dynamic or the idea was to you could load up a female with a decent amount of or their normal carbohydrate intake during that follicular phase, and when they hit the luteal phase, you might want to bring it down a little bit, which kind of seems a little counterintuitive because the BMR kind of raises in that luteal phase. But it was more or less like they could make use of the carbohydrates better in the follicular, and probably due to the hormones is what he was getting at, the estrogen, compared to the luteal phase. So please, thoughts.
Yeah. So when it comes to nutrition, it's the same thing with training. We just don't have enough data. And
Mm-hmm.
that a lot of the research that's been done is it's been looked at in quite in isolation. So for example, only looking at, let's say, insulin responses
Mm-hmm.
without actually looking at insulin responses and then what's the hormonal milieu that's occurring in those individuals. They're just looking at insulin on its own.
Yeah.
Or they're looking at insulin on its own and they're not looking at, well, what's happening with inflammation, what's happening with um, just glycogen and the overall utilization in the skeletal muscle itself. Are we talking about elite athletes that we know then skeletal muscle would be a finely tuned machine? Or are we
Mm.
talking about Gen Pop, in which their skeletal may not be um, as effective in nutrient shoveling and handling, or even just like mitochondrial function is not going to be the same. What age are we talking about too? So, in that research overall, it is quite limited.
Mm-hmm.
I don't think we can make these broad-based claims. I think when it comes down to it's the individual at hand. An individual, let's just say that's got a menstrual bleed, but it's anovulatory and they are hyperandrogenic with a degree of hyperinsulinemia. Should we be loading them with carbs in the first half of their cycle? Like, does that make sense?
Yeah. Yeah.
Or what about somebody who is, um, let's say, they have a regular ovulatory menstrual cycle, they are an exceptional performance athlete. You've been using, let's just say, basic fundamental nutrition with them, where it's like fueling workouts and supporting recovery, eating adequate amounts of dietary protein. Should you then come in and micromanage all of a sudden if what's working is working
Work.
for
Yeah.
them?
Don't fix something that's not broken. Exactly. Yeah.
And then also not creating this like hyper fixation around something that we don't have enough data to support in the first place.
Yeah.
Right.
Yeah. I think a lot of this, like with the nuance, it comes with some of those outliers, right? Like you just gave a perfect example. And I think what at least Lyle was trying to do in the past was just focus on like the average, right? But then you
Yeah,
get into, well, not everybody's average, right? So
yeah,
you're giving out this information to the masses,
yeah.
and now the person who is an outlier is following your information and it's hurting them. So
Mhm. And
yeah.
even just the underlying research too. It's that the research that was conducted, like it's no different than the research that was conducted on performance, where you're looking at just really shitty research
Yeah.
that wasn't actually measuring hormones, research that was being done on different populations, like your recreational versus your elite athletes versus your sedentary, and then comparing these outcomes or using animal model studies and some finding that was done that just cannot be extrapolated and apply to that. I mean, when
Yeah.
we think about, let's say, the impact or let's say the relationship between estradiol and insulin, it's not and or. It's not that high insulin states are going to create or high estrogen states are going to create a certain impact on insulin or
Insulin
vice
sensitivity.
versa. It's a bell curve. Low estrogens and high estrogens are both going to have a different impact on insulin signaling, insulin response, and that it's in the middle zone where we have the healthiest kind of let's say, insulin handling. And that, but it doesn't happen alone. Well, what's androgens doing? We know androgens have a relationship with insulin. We know that other hormones do too. Let's say IGF-1 and growth hormone. We know that these hormones are not happening in isolation. So why would we create a finding or a claim that puts them back in isolation when it's this big interconnected mess that's happening in our bodies?
Yeah.
Yeah.
Yeah, no, that was very eloquently put there. Let's shift a little bit.
Yeah.
I'm gonna try to navigate this ship, and go a little bit before we get into your research, which you touched on just a tad.
Yeah.
We want to talk quickly about pharmaceutical estrogens and progesterones. So have how have pharmaceutical estrogens been
Mm-hmm.
used historically in elite competitive sports?
Yeah. Um, Favorite topic as this is my research. So good segue there. So pharmaceutical estrogens, progesterones. So that's a name that I have given this class of drugs because within kind of the sporting world, there typically have been only called one thing, and that's hormonal contraceptives. And they're used for many different reasons beyond contraceptive purposes. There is a little bit of research that's looked at like hormone replacement therapies in populations such as like menopausal, postmenopausal women. But it's a lot more limited when compared to the research that's been conducted on combined hormonal contraceptives, particularly the oral contraceptive pill. And the reason why I use the name I do is that to me is it reflects this depth and breadth of compounds that are being used for many different purposes in many different forms for just many different underlying physiological responses that can also happen. It's not a one size fits all. When we think about, though, how have they been used historically within the sporting population? Initially, the main reason was as a tool to control the menstrual cycle for performance purposes. So it wasn't being used to treat any type of health issue per se. It was to be able to achieve uninhibited athletic performance when, and this is the big kicker, the menstrual cycle would stop them from being able to actually participate in sport.
Mhm.
So it was a tool to circumvent rules,
Right.
social rules, and
Interesting.
actual institutional rules, or a perceived decline in athletic performance as a result of the bleed itself. So even before premenstrual syndrome was a thing, a diagnosis that was made, it was that the bleed itself was seen to, cause this decrease in performance. Not in all athletes, though. It was like at certain types of sports, there was this like belief that existed, no research to support it. So that was like the main grounds for it. And then over time, more uses got used. So you start to see it being really used as this therapeutic tool to support amenorrheic athletes in the 70s, the 80s, the 90s, the 2000s, and still today, even though research has shown that that's not what we should be using to support amenorrheic patients at all. That was the drug of choice. It was specifically again, the terminology here, it would be a non-bioidentical or a synthetic estrogen in combination with a progesterone, which is a synthetic version of progesterone. Both of these drugs, they do not do the same things that the hormones that we make on our own naturally do. Some of the properties and outcomes are the same. Some of them are different though. So those are like the main things. It was health reasons, amenorrhea in particular. It was, and then also like menstrual cycle dysfunction. So individuals that would have like heavy cramping or heavy bleeding. And so instead of investigating why that was happening, they would give them the oral contraceptive pill. It was also used for performance purposes. So this idea that taking it to control the bleed or control the hormonal um, shifts of the menstrual cycle would be advantageous for performance. And then the last one would be to improve participation when it wasn't allowed because of rules around menstruation and sport.
And you touched on the fact that you've done your own research on some of this stuff. Can you touch
Yeah.
on your research in particular and what you've looked at and maybe some of the
Yeah.
findings that you have seen with this?
Yeah. So my project has changed a lot. So, to give you guys some context. So, initially, when I first started my PhD, I actually wanted to study pharmaceutical androgens within the female athletic population, because at that time I was like, they're not getting enough attention. I
Mhm.
did not know, though, little did I know where I would end up today. Essentially, what happened is I was trying to do my literature review and getting really frustrated, that I just couldn't find any good empirical studies on androgen use in the non kind of clinical population of women. And I was like, this is infuriating. And so I was like, when did we first start to talk about females using
Right.
pharmaceutical androgens? And what I found was a study it was actually like a review that was done for what would now be the World Health Organization, on the use of doping or drugs in sport. And this is from 1938. And to my surprise, what was listed was the use of an estrogen in the female athletic population, not androgens. And I was like, I can remember where I was in my office at the time. I was like mind blowing, like just like, say what? Like this is associated with doping? Like, what do you mean? Like that's not how we think about it today.
Yeah.
And
Yeah.
that really for me started this curiosity going like, okay, so how do we think about these drugs in relationship to high performance sport and the athletic population? I knew my own story, and I knew that my story wasn't unique in terms of being a young athlete being put on an oral contraceptive pill due to heavy menstrual bleeds. I knew that that story wasn't unique. And so I really then just dove into this world of trying to understand, how have these drugs been discussed, prescribed, and regulated within sport, and kind of
Mhm.
the nebulous of sport being high performance sport, the athletic population, competitive sport. What has sports science done in terms of research? What have been their findings? How have they even studied these? Because I started to look at some of the calls to research that were being done. This would be back in like 2017, 2018. There were a bunch of calls to research in the sports sciences going, we don't have enough research on women athletes. We need more research. And especially on how the contraceptive pill impacts athletic performance. So I was like, okay, so we want more research, but like, what have we actually done here?
Mhm.
And and then also in terms of like regulation, for me as this like super geek being like, well, the molecular structure of these drugs is not that different than the molecular structure of androgens, and that some progesterones have androgenic effects. So like, why are we banning one and not banning another? Like, went full biochem on that, and really again wanted to understand where we are today and how did we get here. So how did we get to this place in 2024 where the oral contraceptive pill is not seen to be a performance enhancing drug? It's not regulated under the World Anti-Doping or organization at all. It's not regulated for use, and that it's the number one drug though being used in the athletic population. Far exceeds rates of use of anabolics, which have gotten all the attention, or growth hormone or EPO. So I was just like, there's something's just not lining up here, where we're researching it very openly, getting a ton of funding for it in
Mhm.
sports science labs, but we're not necessarily understanding why athletes are using it in the first place, or how it impacts their performance, if it does. Um, so I guess in a nutshell, I mean that's my work. It was a beast. It is a beast. It's interdisciplinary. So I have like my supervisor is, I mean, he's the head of kinesiology sport science. I have a sport medical doctor who is like an OG in the world of women's health as well. But then I have my like a sociologist that studies drugs, drug testing in sport and sex testing in sport. And then I also have more of like a humanities kind of sport history as well. So I go the spectrum. I have the natural sciences, the humanities, and the social
Sounds
sciences.
not like an article, but more like a book that you could read. That's awesome.
Yeah, yeah.
What do you think, you are a very detailed person, as I would anticipate somebody in your field to be. How do you deal with looking at doing or conducting research in this area? What are some of the limitations, challenges, where you're actually studying humans, right, who are already complex and in their hormonal Oh,
The
no.
worst research
And
subjects.
also, how do you also
Yeah,
get them? How do you recruit those
yeah,
participants too?
yeah.
Throw that in there.
So yeah, so full transparency, I'm not doing human research because of a few things. Number one is getting ethics for research on women and drugs. And when you start talking about steroid hormones, because I refuse to not use the proper language, is extremely difficult. So I'm kind of making a point here and shooting myself in the foot, but I'm okay with that.
Mm.
Because it's for me, what's really important is to have my integrity as a researcher, and that I wasn't willing to fudge my ethics forms using the language that I'm also trying to change. I was not okay with that. So I made a decision early on that I was going to do more of a narrative document approach to be able to build the foundation for other people to do more of those human trials.
Nice.
So that was number one. And that was like a very strong, and I'm like, I still fought this at a meeting a couple weeks ago with one of my committee members being like, I'm defending in a few months. I am not doing more research now. Like, no, I have like way too much as it is. But that was always my intention. It was okay, how can I help researchers moving forward with this? Um, so when I look at though, like some of the challenges I've had, when we think about like how does an individual or individuals conduct a systematic review of the literature, that's one of the foundational steps you do when you're doing a research proposal or any type of article. We have to have some type of understanding of what the literature has said. So in my world, there's been so many different names used for these substances. So you can't just go into PubMed or Scopus and just use a single term. And then you also have to recognize that these terms have changed over time. And so something I recognized was there was a review done from a very knowledgeable group of researchers in the female sport world, the hormones, female sport world, menstrual cycle. And they said in there was one liner and it caught me, and it said that um, hormonal contraceptives have been used in sports science since the 1980s. And I was like, where did they get that from? Because I have all of this information that predates. So
Right.
the hormonal contraceptive pill was released to market in the US in the early 1960s, and then other countries following. So, but that was simply a reformation of the same drugs that were used for a decade before. They just weren't called the oral contraceptive pill. They couldn't because of laws. And so I had all this research in which that drug was being used in the female population in the 50s,
Right.
and research that predated that and had used it in the 30s. So I'm like, okay, so here's a group of really respectable scholars, love some of their work they're doing, and they've dated the use of the pill in sports science back to the 80s.
80s.
But so then I go, why? Well, when I went to PubMed Scopus and I tried to do a lit search with those terms, the pill, the oral contraceptive pill, the combined oral contraceptive pill, hormonal contraceptives, so four different search terms, that's what came up. So I don't fault them
Yeah.
because that's what came up. But again, when we look under the lid, and one of the findings that I have with my project is that we've treated this really big class of drugs as one. And the same thing we see happening with pharmaceutical androgens. So, for example, with pharmaceutical androgens, people go, okay, they're anabolic steroids or they're anabolic androgenic steroids, but they don't think about what are the drugs housed under that umbrella. I mean, trenbolone is a lot different of a molecule risk profile, effects profile than testosterone or oxandrolone, but you call them all the same thing. You associate the risks as being the same, the outcomes as being the same, and that's just not the case. Well, the same thing happened within oral contraceptives and sport, where you have this big group of drugs that have so many different routes of administration and specific actual biochemicals being used for many different purposes in many different populations being labeled as one thing. That's problematic no matter where you're in the research world. That's just not how we do it, but it's what's happened and how we just understood this drug. And I think that's where more of like my sociology's humanities background comes in, because it's not just saying what's the literature on this, what's the research on it. It's how do we know what we know about this topic? What are the actual theories What are the methods that we've used? Why have we used them? Why have we used them and not something else? Um, and I wish I show you guys after my diagram, but I can't release it yet to the public. But I have this really cool diagram that I cannot wait to show people because it is my baby. But essentially, like one of the things I wanted to be able to do is provide actionables, right? It's really easy to be a researcher and up in like the quote ivory tower and not actually give people anything. So one of the things that I was just like, no, this is really important to me was to create visuals from my work because I'm a
That's
visual
awesome.
learner. So
Yeah.
being able to say like, okay, when we study these things or when we are going to be researching them, doing a lit review, what do we have to be calling them? What should we be looking out for? What's the type of language? I mean, I found papers in which they called them, I kid you not, I had like 49 different terms used.
Oh, wow. That's crazy.
So,
It's crazy how important language is just in, just in searching and doing that systematic review, right? And
yeah.
then you barely touched on the legal implications, right? There's so much, in the United States, for example, a lot of these substances aren't used or cannot be used in athletes like they're illegal. And so
Mhm.
it's
Yeah.
very difficult to conduct research on it when you have the legal
Mhm.
implications around it.
Yeah. Yeah, absolutely. And that's why too, like, so initially when I was looking at, doing more human work, and I was focusing on pharmaceutical androgens, I was just like, I was looking at like all the randomized control stuff and all the different other ethical reviews. And I was like, oh no, like this is not going to get through. Like, unless I do, unless I do interviews, but
Right.
I'm also talking about why interviews aren't a good method for this
Right.
because of the complexity involved.
Our
Our dog's
Um,
dogs.
gonna join us.
I locked mine out of the room. um, but yeah, so and obviously you guys can probably tell like I'm really passionate about this because I feel like when we ask that question of like why don't we know a lot or why don't we have a lot of good data around female athlete health, female athlete performance? Like why do we have this giant lacuna that exists, this void? And for me, it comes down to we have researched them. I mean, the first study done on female and kind of like athletic and menstrual cycle was done before the turn of the 20th century. Like it's old. We've had this fascination with this topic, but it's the methods we've used to study it that have not been adequate to actually encompass the chaotic inner dynamics of not only human performance, but also human health and also female health. And then for me, also the drugs being used and the substances being consumed. And that it matters because, like, a great example, I use this in one of my chapters, is that, there was a call in one of the research kind of reviews recently saying that, we have a lot of athletes using the hormonal IUD now, and that we don't have a lot of information about how the hormonal IUD, such as the Mirena, impacts athlete performance. But then that was it. And they walked away. And I was like, 100% agree. There's not a lot of information on it. But when we look at like the actual physiology of what does the IUD do, how does it work, we know that the duration of implantation has an kind of a different impact on user. So after initial implantation, it's a reservoir. So meaning that the reservoir contains a progesterone and that slowly gets released over the course of time, whether it's a 4-year IUD, 5-year IUD, or 7-year, which 7-year they tell you to use contraceptive for the last 2 years because they can't actually say whether or not it is going to still be
100%.
protective. 100% exactly. But in those first 1 to 2 years, there's a more amount of hormones getting released. And so if we think about, okay, well, how would I study this then in an athletic population? I can't just study all IUD users then, because we
Right.
now have different potential underlying hormonal milieux occurring depending on the duration of insertion. And
Yeah.
that's an important thing because if we don't talk about stuff like that, those nuances, we're going to keep doing this research cycle that we're in right now, where
Right.
we want more research, we do it, but it's not good enough. So then we do more, and then it's just this continual perpetual cycle. And that something like that, I've had people like that I've talked to about my work in kind of my research community go like, well, that's just a nuance. And I'm like, is it?
Yeah.
Because to me, that's a big deal. If we think about, let's say, the absence of a bleed, in a hormonal IUD user, that typically happens the longer it's been inserted. However, in that first kind of phase of use, there's more likelihood of abnormal uterine bleeding, which can be totally unrelated to what their old menstrual cycles used to be. Well, if I'm an athlete and I perceive that every time I get a bleed, it's devastating to my performance, sure shit, that's going to impact me
Yeah.
like 100%. And so we do have to talk about these things. We do have to recognize these nuances and differences. All hormonal contraceptives are not made equal. All combined contraceptive pills are not made equal. Users and how they interact within the individual body differs. And so, like I said initially, like we can do our best to get research, but we still need to account for the nuances that we can. And for me, this is one of those, we can account for this, and we should be accounting for this.
Yeah. So just touching
Yeah.
on your research with you specifically, what
Yeah.
aspect of your research is the most
Mm-hmm.
exciting to you? Like, what are you most thrilled about in terms of your research, if you could say?
Is being done an answer?
I love it.
Yeah, it's been a long time. And I knew this though, between like yeah, COVID and like changing supervisor, like I knew, and then the battle of the beast that I'm up against. What excites me the most is that I have come into this area of research that has not received a lot of attention from scholars.
Mm.
As an interdisciplinary research, one of the things that fires me up is the fact that within the humanities and the social sciences, there has been like, I kid you not, 5 discussions, not focus, but just have been included in social science and humanities discussion in terms of estrogens and progesterones in sport. That is it. 5. So when you look at the amount of like historical and sociological research done on pharmaceutical androgens or anabolic steroids, I mean, you could fill a library. There has been so many books and reports and different types of research that's been conducted, both qualitative and quantitative. It's huge. Less than 5 on
Yeah.
pharmaceutical estrogens and progesterones. And they're
That's
not
crazy.
actual studies of focus. They're just like included within. So that whenever I go to conferences, I mean, especially in the social sciences, like that fires me up because I'm just like what
That's it.
the voice I want to say is like, really? Like, why? Like, what? Because to me, I go like, okay, if we're talking about drugs and sport, like you can open up a textbook on drugs and sport, even in the sports sciences and the natural sciences, and it is not going to contain pharmaceutical estrogens and progesterones at all. You can open up
Crazy.
a pharmaceutical and sport, and it's not going to include them. So why do we have this drug that's being used by some reports over half the elite female population,
Right.
and we're not including it in a textbook on pharmaceuticals in sport, drugs in sport, exogenous or endogenous influences on sport performance? Like, to me, that is such a massive, I mean, shame is not strong enough because I'm a side effect of that. So yeah, it is personal.
Yeah.
But I also work with so many individuals over time, so many clinicians, so many even people that are working in like exercise science labs, and they just don't know. They just have
Well,
no idea.
and these drugs are powerful. Like they're so common, they're out there.
Yeah.
They're very powerful. And I think because of the commonality, especially on the physician side of giving them out all the time, we don't realize how powerful these drugs are. I love the research you're doing. I love that you are bringing this to the forefront and that you are, even when you said, I wasn't going to do research that I couldn't use appropriate language for, like steroids. I can appreciate that. I love that. I'm so glad that you exist and that you're doing this
Oh,
work.
thank
Yeah,
you.
you
I
are a
appreciate
pioneer.
that.
Yeah, you're a pioneer. And although it is pretty sad, like you said, shameful that there wasn't a lot of research done on it, it opens up the door for you to be that pioneer to actually shed some light on it. So this was an amazing conversation. Absolutely love it. I think we definitely want to have another one with you in the future on what was it?
Steroid.
Yeah, the performance
That's
enhancing
my
drugs. So,
therapist.
and
Yeah.
like you said, that's your wheelhouse. So that would be a great episode. But for our listeners, where can they find out more information about you, your work, and kind of stay up to date with what you're doing?
Yeah. So it's just Victoria Felkar on everything when I post, which is not a lot. But I will get better. I've been threatened. I've been threatened, so I will get better. But so that's just on Instagram, Facebook, and then my website is just victoriafelker.com. I've got a lot of really cool stuff like in work right now. I'm flexing different like brain pathways that it's just great. Like the amount of work I'm doing right now, just super, super cool because, you get to a point, I think, as a researcher in my world where you begin to feel like you're not making a difference because you're stuck in the trenches of just writing data.
You're in the
And so now
details.
oh gosh, now to be able to actually do projects and different types of reviews and different types of commentaries that are actually making like applicational impact feels so good. So good. So
Awesome.
I cannot wait for
Awesome.
those to get out. Yeah.
Yeah,
That's
we're
great.
excited for you.
Yeah, definitely.
And
Thank
we're
you.
excited that you're going to be done soon too.
Yeah.
That's awesome.
Me too.
Congrats.
Yeah.
Me too. I cannot wait.
Awesome. Well, thanks again for sharing your time and for educating everybody who's listening in, especially myself. I'm glad we had that conversation and you debunked me with what I put out back in the day with trying to get nutrition aligned with some type of cycle. So thank you for that. And we really appreciate your time.
Thank you.
So on behalf of Balanced Bodies, we just want to say thank you for joining us on this episode of the Balanced Bodies Blueprint.
We are committed to bringing valuable content. And if you enjoyed today's episode, we'd greatly appreciate it if you can take a moment and like it and leave a 5-star review.
On Apple, just go to the show, scroll down to the bottom and rate it there. If you're on Spotify, go to the show's page, click the 3 dots, and you can rate it there as well.
And if you believe in the power of knowledge, share this episode on your social media to try and get the information out there to as many people as possible.
And as you navigate your own path towards better health, remember that Balanced Bodies is forever in your corner. See you all next week.
The podcast content may include discussions of medical topics and health-related information. However, the information provided should not be considered exhaustive or complete, and it should not be relied upon as a substitute for professional medical advice or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition or treatment.